I hope my screen is visible. Yeah. So greetings and good morning to all of you. Today, yeah, thank you. Greetings and good morning to all of you. Today, I'd like to share my experience and our study on using yoga interventions in the management of COVID-19 patients. So we have been doing yoga intervention studies in leading institutions, medical institutions across the country. We started off with Rajiv Gandhi Super Speciality Hospital. It's a 2,000-bedded hospital in south of Delhi, and this whole hospital was converted into a COVID hospital here by the government of Delhi. And we started off with the yoga interventions, integrating yoga interventions into COVID care. And even today, we have about six of them, six yoga instructors and two doctors are appointed round the clock for imparting yoga interventions for these patients. We also started off in Ames Jajjar in Haryana. It's a National Cancer Institute. We did in Lady Hardinge Medical College. We started off the work in Ames Delhi. We also started off the work in Ames Rishikesh as well. So we like to go in detail about how we integrate yoga into COVID and why yoga is very, very important in COVID-19 patients. So all of you are aware that since the onset of COVID-19 in April 2020, there was a psychological pandemic along with the pandemic of COVID also. In a sense, there was fear, there was anxiety, there was depression, there was a lot of uncertainty about the trajectory of COVID, and people had a lot of fear psychosis on COVID. The day we entered into Rajiv Gandhi Super Speciality Hospital in the month of April 2020, we had there was a report of a suicide, a man falling down from the sixth floor of the building, and he had committed suicide because he was diagnosed with COVID. And this person just had mild symptoms of COVID, mind you. So it is a curable kind of a disease, but the fear factor which spread widely across the country led to several suicides during this time, and led to so much amount of anxiety because most of these patients are in isolation. They are not allowed to meet any of the relatives. They are completely isolated in the center for about days together, and this causes certain distress as well. And those who are in ICU can get delirium and become confused as well. So this COVID is not just a pandemic of sorts, but it also has a psychological pandemic accompanying COVID pandemic as well. Okay, so we began our study with COVID-19 patients in these hospitals. But even before we go into the aspect of the study, I'd like to share that the severe form of COVID is seen in only 15% of the population, which is above the surface. Majority of them have mild or symptoms or are asymptomatic, and they are under home isolation. You must have seen there's a lot of reports of zero survey done in various cities across the country, and you find some people positive on the zero positivity is there in some people, though they are completely asymptomatic. This is the dormant population, which is below the iceberg, we call it as. Only those whom the iceberg which we can see are those who have overt clinical symptoms, require oxygen therapy, require hospitalization, require ventilator support, or may require ICU as well. So we all know the symptoms of COVID. Fever, very common, most of them. Loss of appetite, fatigue, loss of smell, shortness of breath, coughing, sputum, muscle aches and pain, and very important is the loss of taste, and also GI disturbances such as diarrhea. Okay, so now COVID is just not a disease of the lower respiratory tract or the lungs, but it also affects other systems of the body. It can affect coagulation problems, can cause clotting, and can cause cardiomyopathies. It can cause abnormal liver functions, renal functions, and it can also cause stroke as well, or transient ischemic attacks as well. And it can also bring down the blood counts. So it is a systemic kind of a disease and not just confined to your respiratory tract. And now, yes?
So the slide is still in the first.
Am I audible?
Presentation is still on the first. Yes, sir. The presentation is still on the first slide.
Oh, it's not moving, huh?
No, sir.
1 second, please. Now you can see the slides moving.
Yes, yes, sir.
This was the second slide which I talked about the iceberg concept, and these are the symptoms of COVID. And now I come to what is called the myths about COVID. This is the fourth slide. And
So I
during the
think you
same
can
time,
remove that format background so the
one
slide will
second,
be visible little larger. Yes,
is
sir.
okay? Yeah, because if
Yes,
I
yes.
make full screen, it won't move probably, I think so.
Yes,
I
yes,
think,
sir.
okay. So we'll talk about the myths about COVID, and this is something which was there in April 2020. So looked up at the World Health Organization website, and we saw there were 15 myths about COVID, and these myths were very very important because this was raging in the communities. Like people were professing that breath holding for 10 seconds or more frees you from getting coronavirus. Coronavirus affects people of all ages. People who are under the belief that coronavirus affects only the elderly and not everybody. Coronavirus is transmitted during all climates. People thought it can be transmitted only in the cold climates because initially when the COVID started occurring, it was most in the Nordic countries in the northern hemisphere of the world, and they thought it is mostly in the cold climatic conditions. People also understood that because ethanol can kill COVID, the alcohol can kill COVID. People also believed that drinking alcohol can prevent COVID. And exposure to warm temperature or sun can about 25 degrees can also kill COVID. And you had people when you bring vegetables or groceries from the shop, you had people who soaking the vegetables in salt water and then drying it in the sun for about 2 hours so that there is no coronavirus. Okay, and eating garlic prevents corona infection. Improving immunity improves prevents corona infection. So very important to understand is infection is the moment a virus or a pathogen enters your body, you are bound to get have an infection. So the body tries to ward off or kill the virus or the bacteria by mounting an immune response. So just by having immunity doesn't mean that you won't get an infection. You will get an infection, and the immune system is going to play a very, very vital role in clearing the pathogen or the virus from your body by fighting against it. So having that improving immunity doesn't cause infection is wrong. And silent rinse prevents corona infection. Spraying alcohol and chlorine all over the body prevents corona infection. Taking a hot bath prevents corona infection. Okay, you can recover from coronavirus. Okay, people think they could not recover from coronavirus. Hand dryers are effective in killing coronavirus. So there's so many myths about COVID which it was found among the communities, and this was causing a lot of distress in the population as well. And most of these myths were also found by certain social media as well as the digital media as well, because most of them were on online mode, and they were trying to search for COVID cures, boosting immunity, and all other things which I'll come to later on. Okay, so we did a very big study, a cross-sectional study of about 4,002 responders over 1 year over the last 1 year, and we are looking at um, what is the prevalence of myths among the population with regard to COVID with these 15 questions. Now, in the same time, last year when you saw WHO had 15 questions, but at the same time this year, WHO has got 44 questions which are related to myths about COVID. In the sense, the myths have only doubled or trebled as far as the communities are concerned. Now, people talk about even 5G. Okay, 5G towers which are coming up now are also the cause for the second wave of the pandemic. So all sort of stories are coming up, and so a lot of hypotheses are coming up regarding myths about COVID. And now we what we saw was very strange. The myths about COVID prevalence was about 93% initially, and went down to touch even 100%. Means everybody had some form of myth or other. So out of 15 questions, the average amount of myths was 6 questions with 50%. It increased to almost 60% in these patients over 1 year time period. Okay, and what we also saw during this time was to look at Google search engine with all these keywords. Okay, COVID cure, coronavirus cure, boosting immunity, etc. Why this was important is because if you remember, during the last 1 year, a lot of advertisements have come in the market or in the media space, in the TV as well, where you can see for plywood. Plywood can boost immunity, can kill virus. Paints can kill virus. Okay, detergents and soaps can kill virus. So everything is there for anything and everything is harping on the word boosting immunity. And if you look at the search for this particular term, boosting immunity, it just shot off over the last 1 year. Okay, and we also saw that people started using uh, products which are all claiming to improve immunity or boost immunity. It can be Ayurvedic product, homeopathy, Siddha, naturopathy, just a herbal decoction, herbal product, whatnot. So a lot of sales of these products are also seen, A lot of companies are also formed, which led to increase boom in this particular business or in this product business. And what was interesting to see was the percentage of the myths also increased consistently with the number of articles being published in the Google search engine among the COVID related myths. So we did this study after during this whole year. This survey was done, and now I'm just going to come to the landmark study which we have been doing now. Okay, and this is before I go to the actual study of using yoga for COVID. You should understand how does stress affect infections. So there's a study done in 1991, which was published in New England Journal of Medicine. This is a landmark study by Cohen, Septon et al. Okay, Septon Cohen is a very very relevant name in psychoneuroimmunology. So he really brought about the pathways and mechanistic pathways about how psychological stress can impact neuroendocrine immune response. So what he did was he took a group of volunteers. He gave a nasal spray containing respiratory syncytial virus and coronavirus, not this coronavirus, but other strain of coronavirus. And he saw the number of episodes of flu. He saw the duration of flu in these patients. He saw the severity of flu in these patients. And he found out that patients who had negative life events, had stressful life events in the last 1 year or 2 years, or who had so much amount of psychological distress, had higher episodes of flu compared to those who did not. And he also tried down to see that these patients with higher distress had lower secretory IgA levels or increased inflammatory cytokines and inflammatory mediators, which cause these flu symptoms. So now this is very clearly established that stress can really cause infection or increase the propensity for an infection. This is very very true because even during examination time, most of us fall sick or ill with cold, flu, or even chickenpox, for that matter. So we fall for these viral infections very soon during examination stress because this dampens your immune response. So another aspect to talk is we have a lot of NCDs across the country. So right from metabolic syndrome to behavioral disorders, cardiovascular disease, musculoskeletal diseases, digestive imbalance, etc. And all these are because of physical inactivity, hypernutrition, and stress. And because of the lockdown, the inactivity has only increased. The nutrition is also only hypernutrition or eating is also increased, and stress is also increased because of the lockdown environment. So all these can really fuel this particular pandemic. So there's another study done by using exercise versus meditation in the times of an endemic season or a flu season in Wisconsin University in US. This was published even before this corona pandemic came to fore. This study was done in 2018, and what they saw was giving exercise or meditation during a flu season reduce the severity of flu episodes, reduce the duration of flu episodes here as compared to the control group. Okay, so all these show that yoga plays a very very important role in management of infections as well. So what do we do in COVID-19? What is important here? We know that COVID-19 is the route of entry is mainly through the oral cavity or the nasopharyngeal cavity, right? So the mucosal lining in the oral tract as well as the nasopharyngeal tract are very very important. So improving and preserving the mucosal immunity there is very important. And the one thing which can really do that is Neti Kriya and Pranayama. Okay, and improving viral clearance. The virus can be cleared from the body or from the mucosal response through production of antibodies and not by any other means. So taking good nutrition and having reducing the stress and doing pranayama, asanas, etc. All these things will help in producing the antibodies fast to remove or clear the virus from the body. In COVID-19 patient, what happens is once the virus enters into the mucosal cells or into the mucosal lining, it starts proliferating, it starts multiplying, and it starts spreading elsewhere. So this proliferation of the virus has to be detected by the immune cells, which come to the vicinity, detect it, produce complements, produce cytokines to kill the virus. But this is not enough because the virus is also rapidly proliferating. Okay, so what is important here is initial response is a cell-mediated immune response, production of cytokines, and bringing these inflammatory mediators to the particular site. You have a cold, you have a running nose, you have coryza, you have cough, okay, and you will be running temperatures. So all these are inflammatory responses to producing a humoral. Sooner the humoral immune response occurs, the faster the virus gets cleared, the lesser the damage to your immune system is going to be. So if the immune system is completely prolonged with cell-mediated immune response, the antibodies are not released in time, and this can cause pneumonia, can cause damage to the lung tissues, and cause more tissue damage. You might have heard about people having oxygen saturation of 90%, and soon deteriorating within a matter of 2 to 3 hours, where the oxygen saturation dips by almost 10 percentage points, like it goes to about almost about 80. And this is under the active inflammation. CRP is very high, and this shows that there is a cytokine storm. Okay, so this cytokine storm can only cause the more damage to the lungs. So using the term boosting immunity is a misnomer. Please do not use this term called boosting immunity, especially with respect to COVID, because you will only harm the patient. Okay, so we need to modulate the immune response. You need to have a lower, shorter cell-mediated immune response, longer humoral response, where more antibodies are there to clear the virus from the body. Okay, so we also use relaxation techniques to reduce stress. We gave asanas to improve the lung capacity, and we also gave patients to take ginger, tulsi, cinnamon, etc. Also were also given along with the treatments they received. Okay, so I think
That means Jay is now joined for our this mental health
12 o'clock.
today 12 o'clock after the session.
Yes, sorry about it. Yeah. So the evidence, there's a lot of evidence for system, cognitive functions and perception. It brings about homeostasis in the body. Samatvam yoga uchyate is what we talk about yoga. Manaha prashamana upaya is what we talk about yoga. It is training of mind, calming down of the mind, bringing homeostasis is what is yoga. Basically, physiological homeostasis, physical homeostasis, emotional homeostasis, etc. And brings out better flexibility and relaxed repetitive movements as well. So all these are some of the benefits of yoga which we have seen with a lot of research and with our experience. So what is important here for COVID is to have mindful practice, reduce the distress, reduce the anxiety of COVID, improve the lung function, improve the secretions, okay? Remove the secretions from your body, especially if you have running nose, if you have cough, cold, etc. Okay, manage the local inflammation, okay, and use these things. So these are some of the asanas which we really used in these patients. Yeah, okay, Sulabha Matsyasana, Shashankasana is very, very useful, especially if you have respiratory distress. It's similar to that of proning. Okay, hands in and out breathing and yogic breathing. The best one among all the techniques which I really saw with patients was yogic breathing. So most of us, we were when there was a COVID going on, pandemic going on, people are running here and there to get hold of oxygen cylinders because there was a shortfall. The reason why people are deteriorating, where the oxygen saturation is going low in these patients, is because these people have not exercised their lungs. They have shallow breathing. They're not exercise their lungs. They have they have shallow breathing, and because they not exercise the lungs and shallow breathing, they have severe infections, and that infections require more oxygenation. The oxygenation supplementation is required in these patients because there is lung damage resulting from the infections. So these are some of the areas where we started looking at improving the lung capacity of this population. There's yogic breathing and doing pranayama for these patients. Kapalabhati we gave in patients who did not have dyspnea, who did not have cough. Otherwise, they were free to do Kapalabhati as well. Okay, this is a multi-centric trial. So I'll be sharing. This is done in these 4 places. It's still ongoing. There's 2 parts to this. We want to look at the effect of yoga and managing acute respiratory illness, psychological distress, anxiety, mood changes, and sleep. Okay, and we wanted to see whether there is any bivariate relationship between the relaxation response and these outcome variables. 86 patients with COVID-19 were taken in the 5-year study in each arm. Okay, and these are COVID-19 positive patients with mild to moderate disease and use criteria 0 to 4, present with or without flu symptoms. But we took only those with flu symptoms because the guidelines changed. Initially, it was that anybody with asymptomatic patients were also admitted initially in the hospital, but later on, only people with symptoms were being admitted in the hospital. So those with symptoms only were taken. Age 80 to 60 years, high school education, written consent to participate. Those with abnormal LFT, RFT were excluded. Those with immunosuppressive diseases were also excluded. And we had 2 arms, the control arm and the experimental arm. yoga program, patients were asked to take a yoga intervention as soon as they joined the COVID care center, and they were assessed at day 0 at baseline, at day 6 or 7, or on day 14 as well. This was the yoga module given to them every day, morning 25 minutes of yoga module and evening 25 minutes of yoga module. And these were the primary outcomes: duration of acute respiratory illness (ARI), okay, illness in days. And we also we mapped the acute respiratory illness by using Wisconsin Upper Respiratory Symptom Survey every day for these patients. And we also looked at time to discharge, time to recovery. We also looked at ICU admissions, requirement of any oxygen supplementation, etc., or death as well. Okay, and we also looked at the following psychological scales: short form 12, perceived stress, Hamilton rating scale, etc. And we also did a very important recording using a sensor device called DOSI. This is a non-contact sensor. It's a small sensor mat which goes under the patient bed, and it measures your heart rate variability, measures your respiration rate, and it is useful for even looking at just quality of your sleep. So this is what we used to get with the patient's dashboard. You can see the disturbed sleep on day 2 for the patient. The yellow curve talks about time to go to time patient, how much time you are. So this is the kind of dashboard you see in patients here. So it will tell you what time the patient went to bed. So you can see their sleep disorder is very rampant in COVID-19 patients. We don't know what is the reason, because they're sleeping at daytime because they have nothing to do there in the hospital. They are alone, they're isolated, and they end up sleeping in daytime, watching movies in their mobile or what it is, I don't know. But they sleep very late and get up very late as well. And this gentleman slept only 4 hours 33 minutes. And you can see the yellow band, which tells you it took 84 minutes for him to be awake during this whole period of 4 hours 33 minutes, indicating that he slept for hardly 3 hours. Okay, and you can see that number of awakenings is almost 7. So this patient had a disturbed sleep, and he had a very poor sleep score of 62. And we also looked at stress levels of stress, and you can see the stress levels were more during different time points of sleep. Okay, and these time points of sleep can also be related to the awakenings and the REM stage as well. Okay, so these are all some of the studies which have been happening in CCR1 for COVID. We also did one more study which is happening in MGM Medical College in Nagpur, and we're looking at what is called a new thing called breath rate variability. So when you see COVID-19 patients, they tend to have apnea episodes, means the respiration suddenly stops in the middle of the night. Okay, and they have to wake up because they feel breathless. And we looked at 116 sleep recordings, 1016 sleep recordings in controls, with 935 sleep recordings in COVID positive patients. And this is what we saw here. You can see the variability in the breathing in a COVID-19 patient, normal breathing in a normal control patient. Okay, so breath rate variability is also a very important marker of respiratory distress. And now we are trying to find out cutoff markers on breath rate variability, which can look at severity of COVID, which can predict severity of COVID, like who is going to go to ICU and who is going to be deteriorating. Okay, so this also work is also going on here in at CCR1. So with this, I end my lecture because I have to get into another meeting. Thank you all for a patient hearing. I will be happy to take any questions. So do we have any questions?
Dear participants, if you have any questions, if there are any questions, you can post your questions in the chat box.
Live speak.
Yeah, okay, thank you. I thank Dr. Naveen and the organizers for having me here to share my views and thoughts on yoga and COVID-19.
Hello.
I would like to be logging off because I need to join for another meeting at 11. Dr. Naveen, can you permit me to do
Sir, anything? Hello?
Yeah, can I leave? I need to log off from.
Yeah. Maybe one question, is it possible? Do you have time, sir? Maybe I will.
Yeah, please tell me.
Yeah,
Please go ahead.
yeah, yeah. For mild to moderate severity, how naturopathy and yoga has been highly beneficial. Could you share your experience with severe, form of COVID-19? How we can
Very good,
manage
very good
physically?
question. Especially in the people who are in ICU, basically, people who are in ICU who have very low oxygen saturation, who are on non-invasive ventilation, like they have a BiPAP or a CPAP machine. They're not intubated. They have a non-invasive ventilation. So these people also are people who have pneumonia, who have consolidation, and who have pleural effusion, and who have thick secretions. So what they are using there, it is very interesting. A lot of physiotherapists are also working in these COVID wards in ICU settings. So they are trying to dislodge secretions there because these are thick mucoid secretions, and they're using vibro massage, and they're also giving hot fomentation to chest as well as back. And we are also doing Shashankasana for these patients, making them to lie down in Shashankasana position, keeping their forehead on the ground, and making them to breathe. Because this, what we have seen is, by just doing Shashankasana and doing this proning and breathing, their oxygen saturation quickly goes up by almost 5 points. Okay, and that makes them better. So this is really been taught to patients who are on non-invasive ventilation, and this is found to be very, very useful.
Thank you very much, sir, for spending your valuable time. I know it is very tough being a director of Central Council for Research in Yoga and Naturopathy during International Yoga Day time. So, so thank you for joining us and spending your valuable time in this tough situation. Thank you. Maybe 10 minutes gap is there.
With this, we come to the end of the first session.